Hello, my name is Erica Hipper, and I'm going to be talking about the American Nursing Credentialing Center's Magnet Recognition Program. During this presentation, I will be explaining what the Magnet Program is and what it stands for. I will also be presenting the benefits of the program and how it impacts bedside nurses, their practice, as well as upper management. I'll demonstrate the impact that it can have on patients and explain how it affects policies and relates to the laws, both state and federal. I will lay out the costs, both the expenses as well as the potential savings of this program. The Magnet Recognition Program is a way to recognize and award healthcare facilities that demonstrate excellence in care in every area known to affect patient outcomes. It promotes strategies that increase quality of care, safety, as well as patient and staff satisfaction. Susan, the Magnet Program Coordinator at Aurora Medical Center, Kenosha, described the Magnet Program this way: is a comprehensive guide to making your entire site an environment where nurses can practice at the top of their license in an environment that promotes excellence at the bedside. As a result of this, nursing best practices are delivered to our patients at the bedside. In 1983, the American Nurses Association performed a study that looked at facilities that were able to attract and retain quality nurses. They looked at 163 facilities. 41 of them contained qualities that were able to increase attraction and retention of those quality nurses. These qualities ended up becoming known as the forces of magnetism. Then in 1990, in June, the American Nurses Association incorporated the non-for-profit American Nurse Credentialing Center. In December of that same year, they approved the Magnet Hospital Recognition Program for Excellence in Nursing Services as a result of their 1983 study. 4 years later, Washington Medical Center became the first hospital to be known as a magnet hospital or as a magnet facility. At that time, only hospitals were being considered. Through the years, they ended up updating the program, revising the qualifications in '87, and then including long-term care facilities in '98. In 2000, they also incorporated outside of the U.S. to include those organizations. The name was shortened and became the current Magnet Recognition Program in 2002, and then the model was updated in 2008 to develop the 5 key components out of those 14 forces of magnetism. By 2011, 6.61% of hospitals in the U.S. had magnet recognition. This is the current model that incorporates the 5 key components. And as you can see, empirical outcomes is in the center, surrounded by and supported by structural empowerment, exemplary professional practice, new knowledge, innovation and improvement, and transformational leadership. The 14 forces of magnetism are within these 5 components. The ANCC said that this new model was designed to provide a framework for nursing practice and to serve as a roadmap for organizations seeking to achieve magnet recognition. They designed the 5 components to help simplify, clarify, eliminate redundancy, and to help focus more on measured outcomes. Any organization hoping to become magnet certified still needs to show excellence in all 14 forces of magnetism, though. The first component was transformational leadership, which incorporated forces 1 and 3, which were quality and nursing leadership and management style. In their research, they found that quality leaders translated to increased nursing practice at the bedside. These quality leaders possessed qualities such as knowledge, they were risk takers, they were visionaries, they were organized. At all levels of the organization, they advocated and they supported their staff. They were strong leaders and they came alongside and helped the staff. The style of these leaders was supportive and partnering. They supported participation with the staff members, the staff nurses. They encouraged feedback and valued it. They were visible and accessible leaders, and they also communicated effectively with the staff members. All these qualities translate to a professional, transformational leader. A transformational leader sees a need, they create a vision, they're able to inspire those under them to also see that vision, but not just inspire them in one way, but to individual that inspiration to meet the needs of those under them. They come alongside and they partner with those under them and encourage them. The ANCC said that a leader is required to transform their organization's values, beliefs, and behaviors and to help lead people to where they need to be. This requires vision, influence, clinical knowledge, and a strong expertise related to professional nursing practice. These leaders guide, influence, and challenge, but they also listen and affirm those who they're leaders over. The second component is structural empowerment. What they found was that a strong structure, including planning, systems, policies, programs, along with the strong partnerships, equaled out to stronger practices. The organization's structure should be decentralized to allow for shared decision-making. Nurses should be strongly represented in all the decisions throughout the company. And the organizational structure should be dynamic and respective of change. Policies should also be helped to be designed by the staff nurse, the one who is in the front line, and they should be based on the quality of care. There also needs to be policies that are focused on salaries and benefits, professional growth within the company, work-life balance. They also need to be creative and flexible with staffing, and have programs such as succession planning. Related to Focus 10, the organization should develop strong partnerships with outside organizations in order to help support the patients and improve clinical outcomes. Force 12, the image of the nurse. Nursing care should be seen and considered as essential, and nurses should have an influence throughout all the processes. There also needs to be strong professional development. The organization should help its employees and support its employees in personal and professional goals. Should help them develop in their careers, education, professional certifications, formal education, in-service education, leadership development, and provide resources to help that professional development. The third component is exemplary professional practice. The organization should support and encourage professional models of care, such as the primary nursing care model, case management model, family-centered model, district model, and the holistic care model. Force 8, organizations should make sure that there's enough resources. They should support and encourage and provide opportunities for nurses to develop and to share their skills with those outside of the organization as well as those inside the organization. And promote involvement in the professional organizations and the community as well. Force 9, nurses should have autonomy. They should be able to use their expertise and knowledge to make independent judgments about patient care. Force 11, nurses should be actively involved in education, in patient education programs, in developing and mentoring programs for other staff members, as well as students. Force 13, the organization should implement and encourage positive interdisciplinary relationships based on mutual respect and an understanding that everybody contributes to the positive clinical outcomes of the patient. Component 4 is new knowledge, innovation, and improvement. There needs to be a continual focus on continual quality improvement, focusing on evidence-based practice, what needs are there in the organization, things that need to change, policies that need to be updated, and any issues that come up. Component 5 is empirical quality results, related to force number 6, quality of care, which everything feeds into. There needs to be this focus on quality care and a continual rebuilding. The whole point of the Magnet program is to promote quality results, to promote that quality of care, to provide an atmosphere where nurses have the best opportunity to provide the best care. Other requirements other than the 14 forces of magnetism include that the facility be a healthcare organization with a single nursing officer over the facility who has at least a master's degree. All leaders, including managers, need to be RNs with a bachelor's degree or higher. The nurse administrator's scope and standard of practice need to be in place, and the facility needs to comply with all state, local, federal regulations for the healthcare system, as well as the Nurse Practice Act and rules of conduct. There needs to be a policy in place that allows staff to give feedback to the organization without fear of retaliation. And the facility needs to be a part of and submit information to a national database, such as the National Database for Nurse Quality Indicators. This database looks at things like falls, infections, pressure injuries, pain, satisfaction rates, staffing, turnover rates, education, readmission rates, and it compares it to other similar hospitals at the national, state, as well as local levels. So these are the steps to become Magnet certified. First, they need to prepare. The first thing that they will do is decide that they want to go for the Magnet certification, and they'll assign a project manager. This person will be the lead and the go-to person throughout the process. They need to know the organization very well. They also need to know the Magnet program very well. They'll evaluate the organization's readiness for the program and put together steps in order to help meet all of the stipulations, regulations, and comply with the forces of magnetism. They'll project a submission date at that point too. When they're ready, they'll complete the application and send in the fees. They'll have 48 months from that point in order to submit all the documentation that shows that the organization complies with the forces of magnetism and meets all the requirements. The documentation will have to show that evidence, and it will contain documentation from the National Database of Nurse Quality Indicators. They'll also submit the application fee with the documentation as well. And then respond to the appraisers if additional information is needed. They'll have 60 days to provide that information after it's requested. If the appraisers decide or determine that the organization is excellent in all the forces of magnetism, then they'll be able to schedule a site visit. There's usually a couple appraisers who come to the site, and this is to help gather more information, to clarify and verify some of the documentation, to determine compliance with all the forces. They'll evaluate the environment that the staff are working in, and they'll also collect feedback from the community at that point. The appraisers will then give a blind, they'll put together and submit a blind report of the site visit, which will then be evaluated and looked at by a 14-member committee to determine and analyze and make the decision on whether or not to award the magnet recognition to the facility. If they decide that the organization does qualify, then they will have that recognition for up to 4 years unless it is revoked for one reason or another. They'll have to submit documentation every year to show that they are continuing to comply, and after the 4 years they'll have to go through the whole application process again. So what does this mean for patients? The magnet program has shown to increase patient satisfaction. It also means that patients are going to have a more highly qualified nursing staff. The forces of magnetism were called the forces of magnetism because these qualities helped attract and retain the best quality nurses, which means facilities that are magnet recognized are going to have quality nursing staff. They also improve quality and safety. Well, one of the things that the magnet program looks at is staffing. They look at the number of hours that the staff works, the patient ratio, and when a facility is properly staffed, they're going to have less accidents, less errors. There's going to be less missed cares because nurses aren't, they're not overworked, they're not overstressed. The facilities also support evidence-based practice, which means that they're going to be up to date or improving their quality to make sure that their practices and their policies are the best in the field at that time. It's been proven that magnet hospitals also have better patient outcomes. They have lower mortality rates, they have less falls, they have less infections, less hospital-acquired pressure injuries, and so forth. One of the studies I looked at evaluated the association between hospitals with magnet recognition and their patient experiences. It was called Hospitals Known for Nursing Excellence Associated with Better Hospital Experience for Patients. It was performed by Amy Witkowski-Stimfel, Douglas M. Sloan, Matthew D. McHugh, and Linda H. Aiken, published in 2016 by the Health Research and Education Trust. What it did is it compared the results of the HCA-HPS, which stands for Hospital Consumer Assessment of Healthcare Providers and Systems, and it compared the results from the 212 magnet recognized hospitals and the 212 matched non-magnet recognized hospitals. The researchers only used the data from hospitals that had more than 300 patient responses, as was recommended, and only hospitals that had completed characteristics in the AHA survey. The magnet hospitals came from the magnet database, and the demographic of the participants in the HCA HPS were adults who had a short-term stay in an acute care medical, surgical, or obstetric unit. In order to decrease external factors, they matched the non-magnet hospitals with the demographic and characteristics of the magnet hospitals, as you can see in column 3 and in column 4. If you look over in the differential columns, you can see that the differential before matching was very different, whereas after matching the differentials are very close, and therefore there is not a lot of external variation. So this was a quantitative retrospective observational study using the survey results of the HCA HPS survey. IRB approval was received. Consents were not needed as this was retrospective, and patient identifiers were not used. In fact, individual results were not even known, but it was the results of the HCA HPS survey of the entire hospital that was actually being used. The other sources that were used were the American Hospital Association survey of hospital characteristics, so that they could compare the magnet hospitals to the non-magnet hospitals and make that matched set. There was not the external variations. They also used the American Nurse Credentialing Center's database of magnet hospitals to get the list of magnet hospitals. After getting the characteristics and matching the two groups of hospitals, they evaluated the results of the HCA HPS survey, and they compared the results of the magnet hospitals to the results of the non-magnet hospitals using a significance of the p-value of less than 0.05. There were two areas that had the most significant results. When comparing magnet hospitals to the matched non-magnet hospitals, the adjusted coefficient of the amount of patients who rated the hospitals of 9 or 10 were 2.03 in favor of magnet hospitals. And in the area of the patients would definitely recommend the hospital, the adjusted coefficient was 3.22. Although causation cannot be proven, the study does show that magnet is associated with improved patient experiences and an increased likelihood of hospital recommendations by patients. There's also a slight improvement in the perceived nurse communication and discharge teaching. Since HCA HPS scores are associated with reimbursement to hospitals, it is possible that magnet hospitals might have improved reimbursement. However, a pre and post test study would be able to determine causation better than this study did, and therefore be able to show if the magnet recognition truly improved those scores. The researchers recommended repeat studies with new and updated data, as well as longitudinal patient experience studies may be needed. Additional adjustments for characteristics may not be needed in future studies. The magnet program has a positive significance to staff nurses as well. The 14 forces of magnetism were chosen because it's those qualities that helped attract and retain quality nurses. They result in higher job satisfaction, less burnout, less turnover, and an increased retention rate. Because nurses feel supported, valued, and listened to. They also experience higher autonomy, and there's a collaboration between the staff nurse and leaderships. They're involved in shared governance, and so the staff nurse has the ability to influence what happens on the floor as well as what happens with benefits that affect them. There's policies that help encourage and protect the nurse when they need to give feedback to the organization as well. This extra staff involvement is one of the things that a couple of the leaders I interviewed had identified as something they admired about the magnet program. Laura, one of the managers, said that she really appreciates and loves the idea of partnering with the staff nurse who is in direct patient care to be able to meet the needs of the patients and the needs of the staff better. Another thing magnet hospitals do is come alongside the nurse and support their educational, personal, and developmental goals. They help them lay them out. They do succession planning, give encouragement and support. There's usually policies and programs in place to assist nurses in getting a higher education or learning different skills, getting certifications, adding to their portfolio of knowledge in order to develop them into a more rounded individual. These hospitals also promote a culture of evidence-based practice. They encourage and they promote an environment that's suited for promoting quality. They look at what needs to be done. They look at the research and they encourage the nurse to implement these new standards and to look at the areas that need improvement and find solutions to them. This encourages the nurse to work at their highest level of performance and at the best of their abilities towards evidence-based practice. This leads into another study that I found, which was a 3-year pre- and post-analysis of an evidence-based practice integration in a magnet-designed designated community hospital. It was published in 2016 from the World View on Evidence-Based Nursing Journal. It was a quantitative pre- and post-survey analysis. The study looked at the beliefs, readiness, and integration of both staff nurses and leaders and compared the results of the survey from both before and after the integration of evidence-based practice initiatives. What they found was that the integration significantly increased the readiness of both the staff nurse and the nursing leader. It also increased the staff nurse's belief in evidence-based practice. However, it did not significantly change the leader's belief or the integration of evidence-based practice for both the leaders and the staff nurse at that point. There were several external factors related to integration, though. Leaders at magnet hospitals are expected to be transformational leaders. This is not a style that is natural to everybody. It's not the typical boss. It's an inspirational leader. Leaders are expected to transform the organization by inspiring those under them and helping them to understand the goals and visions and come alongside the goals and mission of the organization in order to meet those goals. The CNO at Aurora had put it like this as far as the magnet program goes, that it's important to make sure that others, members within the organization, leaders included, understand why it's important to nursing. That is how a transformational leader works. It's not a dictatorship. It's a partnership. They partner with the staff nurses and with the patients in order to make decisions that are best for everybody. One of the managers I interviewed put it this way: the magnet program decreases the decisions made by leaders with titles and puts the decision making back at the bedside, allowing leaders to partner with front lines to make decisions. It's the nursing leadership, management, and administration that need to foster that supportive environment. Our CNO put it this way: it means that nurses working at Aurora feel a sense of fulfillment around the care they provide, that their professional practice grows in a supportive environment that allows that growth, that the nursing team is well respected as a partner in care and collaboration with other partners in care, and that we are able to attract the best nurses to work at Aurora. There also needs to be a continuous focus on evidence-based practice, and it's the leader's goal to make sure that we're staying on track and that there's this continual quality improvement happening throughout the facility. Lastly, one of the benefits is that nurse leaders at magnet hospitals make 4.8% more than nurse leaders at non-magnet hospitals. Aurora Medical Center Kenosha is on the road to magnet certification, and therefore many of our policies have been affected by this. There's a lot of educational policies. Some of them include the BSN completion assistance and certificate cost assistance policies, which help nurses to increase their education. There's also policies on fall prevention. There's 6 different policies on infection prevention, as well as pressure injury prevention, staffing policies, professional practice, evaluations. There's a couple policies on peer review, which is encouraged by the magnet program. We also have 18 research policies related to nursing research, as well as the anti-retaliation policy that is required by the magnet program. Procedures are also affected by the magnet program because there needs to be this constant review of evidence-based practice and the continual quality improvement, looking at the policies and procedures of a facility and making sure that they are up to date with the current evidence-based practice. One of the examples at Aurora, it was the heparin versus saline for use in central line flushing. Well, with the current evidence-based practice, we found that there really was no significant improvement in preventing clots in the central lines when using the heparin, and therefore our policy ended up changing from using the heparin to just using saline locks for central lines. And in fact, there has been an improvement in clotting. There's been less central line clots since this policy has been implemented. There are no specific laws about the magnet program. However, the magnet program does specify that any magnet facility needs to follow all state and federal laws and regulations related to their healthcare facility. These include the Occupational Safety and Health Review Commission, Equal Employment Opportunity Commission, U.S. Department of Health and Human Services, U.S. Department of Labor, National Labor Relations Board. Hospitals with any adverse event that occurs need to report that to the magnet program, and there's a possibility that their magnet status could be revoked. They are able to repeal after 1 year. They also are required to follow the Nurse Practice Act, the ANA's Code of Conduct, and the Wisconsin Standards for Practice. It actually costs quite a lot to become magnet certified. And just the initial application fee is $5,750. Once you've collected all the data and you submit it, the appraisal fee is then based on the number of beds. For Aurora, it'll be $31,500. Then for the documentation review fee, it's $2,500 for the lead appraiser, and then $2,000 for each appraiser after that. And there's usually at least 2 appraisers. If there's any additional documentation that is needed, then you also need to pay for the lead appraiser and each additional appraiser after that to review that additional documentation, and that is respectively $1,500 and $1,000. Once that's approved and you move on to the site visit, the fee is $1,850 per appraiser per day. There's usually at least 2 appraisers, plus you have to pay their travel expenses and any other expenses that they occur while that they're there. And they're usually there at least 2 days. If something happens and you need to change the date that you submit your documentation, there's a $7,500 fee for changing that day as well. Adding this up, the minimum cost for a small hospital would be over $50,000. And that's not including the salary of the magnet coordinator or any of the changes that needed to be made in preparation for applying for magnet status. The biggest benefits of the magnet program have to do with improved quality and improved safety, which can translate to improved patient satisfaction, which might translate to increased reimbursement. There's another study that I did that looked at the reimbursement of magnet hospitals versus non-magnet hospitals, and they found there was a slight increase in reimbursement. However, market sharing was not changed at all. So the total reimbursement between the magnet and non-magnet is questionable and still needs to be looked at. Another benefit is shorter patient stay. This helps the patient financially because they have less of a bill, but it can also help the hospital as a lot of reimbursements are no longer affected so much by the length of the hospital stay and more by what needed to be done, whether they stay there for 2 days or 5 days, and therefore a shorter patient stay may translate into less expense for the same amount of reimbursement. Another benefit is that there's less errors, less patient events in hospitals that have magnet recognition because of a lot of the implementations and evidence-based practice that they implement. There's less falls, there's less infections, there's lower mortality rates, which can translate to less expense for the hospital. There's also better staff retention, which when there's high turnover, that can be a big expense to hospitals, and therefore when you're able to retain your quality staff, you have less expenses in training new staff members. This is the end of my presentation. Thank you for listening and have a blessed day.